In this week's video, we're going to discuss malnutrition. I'm just kidding. You know I think you all overfeed your dogs. Instead, we're diving into something even more significant, the spine. Following up on our previous discussion about hip health, I believe the spine is often the real culprit behind many of the symptoms that get blamed on hip dysplasia or arthritis, especially in older dogs. The spine is incredibly dynamic, and it plays a crucial role in our dog's mobility. It's made up of three segments: the cervical spine, which controls the neck, the thoracic spine, evidenced here by these processes here, which corresponds to the rib cage, and finally, the lumbar spine, which connects to the hips. Now, instead of thinking of the spine as a rigid rod, imagine it as a series of these individual little joints, with intervertebral discs acting as cushions in between each of them. These discs are like jelly donuts, soft and flexible on the outside with a fluid center. But just like a donut left on the counter too long, these discs can age as a dog gets older. As these discs age, they lose their flexibility. The outside can become brittle and the jelly inside can start to leak out. This process can put pressure on the spinal cord, causing significant discomfort and mobility issues for our dogs. Sound familiar? Think of how many people you know, including some of us creeping into middle age or beyond, that struggle with back pain. That same shooting pain, that protective muscle tightening, our dogs experience it too. And just like with us, when a dog experiences this kind of pain, their muscles go into overdrive trying to protect that area, which often leads to further complications. This week, we're going to take a closer look at the issues dogs face with their spines, particularly focusing initially on intervertebral disc disease and how it affects their mobility. The most common spinal issue I see in dogs is intervertebral disc disease, or IVDD. As I mentioned, the disc is like a jelly donut aging, and it loses its consistency. Sometimes pieces break off or the jelly leaks out, putting pressure on the spinal cord or the nerves as they come off the spinal cord. The symptoms of IVDD can mimic hip dysplasia. You might notice your dog being reluctant to jump into furniture, jump into the back of the truck, or just having difficulty getting up. In severe cases, it can look like they've lost motor control, and suddenly your dog is dragging its feet, having to flop to lay down, or just stumbling as it tries to go about its normal daily life. This is where it often gets tricky because regular x-rays might not reveal the problem. Even if a disc has calcified and it shows up on an x-ray, that doesn't always mean that that's the problem area. The purpose of taking x-rays in these dogs is more about ruling out other issues like cancer or infections in the spine, rather than giving us a clear picture of what's actually going on with the discs themselves. Let me share a couple of real life cases. My dog Belle had these bony projections coming off of the bottom of her vertebra. When these projections started bumping into each other with activity, it was incredibly painful for her. Belle's issues started when she was about 7 and lasted until roughly about 9. But she hunted until she was 15 years old. Given time, often these bony projections will bridge and eventually stabilize. In her case, she had plenty of years left to enjoy her life once we got her through that initial pain and dysfunction. Belle was an incredibly athletic dog. My dad even called her the Michael Jordan of the dog world. But as her spine aged and adjusted to these changes, she wasn't quite as agile. Still an excellent hunter, still able to cover a lot of ground, but her mobility definitely changed. Then there was Maggie. Maggie didn't have the pain that Belle did. Her issues were more functional. She struggled to get up after a long day of hunting, and I even had to carry her across the parking lot at times on multiple day hunts. Even on those nights she had to be carried, she was always raring to go by the next morning. With the right treatment plan, she also went on to have a successful career for years after her back issues. It's cases like my two girls that remind us just how resilient these dogs can be when given the right care and a chance to recover. So how do we treat these dogs with back issues? The answer isn't just throwing anti-inflammatories at the problem. Yes, there is a time and place for these medications, but in most cases, the real issue is the muscles along the back. When a dog experiences that shooting pain, they tense up to protect themselves, and the muscles can end up kind of seizing up. This is where we see more compensatory issues than true inflammatory issues at the side of the disc. Oftentimes that pain is relieved and it's the muscles that are the problem by the time the dog comes in to see me. My approach involves two main steps: addressing that pain and then focusing on rehabilitation. If there's clear pain upon direct palpation of the spine, I will use those anti-inflammatories. For muscle issues though, I'll often use a muscle relaxant. However, the most important component to all of this is rehabilitation. Stretching and targeted exercise help release the tension in those muscles, strengthen them, and improve the dog's overall mobility. This approach is much more effective than relying on medication alone. Now, those of you who follow me for a long while know I'm not one for long-term medication use, but this is one of those situations where I've found some exceptions. My dog Belle was one of those, for instance. She responded incredibly well to a drug called Galliprant. It was like the fountain of youth for her, and I hate saying that. Instead of constantly treating her flare-ups, Galliprant helped her keep her more stable, preventing those dramatic episodes from occurring as frequently. She had a good quality of life right up until the end, which ultimately is what we want for these dogs. In her case, at 16 and a half, we looked out to get both quality and quantity. Now let's talk briefly about some conditions that can actually result in paralysis. These tends to fall into three categories. The first being a condition called fibrocartilaginous embolism, or FCE. This is typically seen in younger athletic dogs. FCE occurs when a piece of cartilage enters the bloodstream and blocks the blood flow to the spine. So basically parts of the disc or the surrounding structure somehow get into the bloodstream and cause this sort of spinal cord blockage. The dog may be running around one moment and paralyzed the next. Depending on where this blockage occurs, symptoms can vary from complete paralysis to just potentially affecting one limb. Disc ruptures are another potential issue that can occur with the spinal cord. Most common, this occurs in middle-aged to older dogs. Kind of the textbook example that everybody thinks of this condition occurs in breeds like Dachshunds. This involved the disc actually rupturing and pressing against the spinal cord. Sporting dogs can experience this too, although it's less common. Depending on the degree of that rupture and the spinal cord involvement, treatment can range to being similar to what we discussed with IVDD, as this is kind of an extension of that, to emergency surgery. Type 3 disc ruptures are the last type of condition that we're going to talk about, and this often happens after a traumatic type of event. The disc essentially hits the spinal cord and then retreats back into position, causing a bruising type of injury. This condition can only be diagnosed with MRI scans and typically affects younger to middle-aged dogs. So it's going to be that dog out running in the field, potentially runs into something, jumps off a cliff, those type of sort of things. And when I say a cliff, I'm not thinking chucker hunting, but like a small rise that the dog didn't see coming. The key point here is that diagnosing these conditions accurately is crucial because the treatment plans can vary widely from doing nothing to aggressive emergency surgery. One note on diagnostics for the spinal cord issues. As I mentioned, x-rays are going to provide some information, but typically in the form of ruling out big destructive concerns like infection or cancer. To be able to actually visualize the spinal cord, you're going to need to have a CT scan or an MRI performed. This is something that also confuses a lot of veterinarians. I'm old enough that we did not have either of these machines in vet school, and even our x-rays weren't digital, but rather we processed actual films. While these modalities are used widely in metros, it doesn't mean that everyone is comfortable with the situations that they are best used for. The short answer is that CT is great for things like bone and compressive sort of changes to other tissue. So with the spine, we will see disc changes if they are actively compressing the spine. MRI is going to be better for vascular issues, inflammation, muscle, or other non-compressive changes. So things like FCE or non-compressive changes like we discussed with type 3 disc disease. We currently in my practice only have a CT machine, and I probably decline about 70% of the cases that are referred to me, as it just would not be the best option based on the dog or the symptoms or what we suspect is going on. When you start talking thousands of dollars for just the diagnostic test, you want to put the odds in your favor of actually getting an answer and using the right technology. And remember, it's essential to get that accurate diagnosis to create a tailored treatment plan, especially for dogs dealing with more severe conditions. In our next video, we will tackle one of my soapbox issues, the knee.